Hello, everyone. Dr. Amanda here, and I am your plant based lifestyle physician and health coach who is here to educate and empower you so you can make the best decisions for your life. Just as a disclaimer, remember this information is for educational purposes only. It is not intended to treat or cure or diagnose any medical illnesses, and we recommend that you contact your own medical professional and ask them specific questions. All right. Well, I have a special guest with me here today, Dr. Eva, and she is here and she is a family medicine physician and life coach. And I'm going to allow her to introduce herself to you all.
Thank you. So my name is Eva Cesnek, Dr. Eva Cesnek MD, or I go by Doctor Evka, which is a Czech version of Eva, but it's like the diminutive version. And I help families where the parent is in the sandwich generation and they're a caregiver to both their parents as well as to their children. And in each of these cases, somebody has special needs. So I write books about medical conditions that they're probably trying to help the care of, because sometimes when you see a doctor in the office for like 10 to 15 minutes, you don't have the time to have everything addressed. And yet you're the caretaker, you're with this family member for such a long time. And how nice it would be if more of your questions were answered. And so I like to do that in an evidence-based way with lots of like the latest information, like stuff you might not even necessarily get anywhere else. And the goal for that really is to make sure that they're educated and maybe feeling a little bit less stressed. Because when you are caregiving, it can be incredibly stressful. And knowledge can equal power, especially if you know what to do with it. So when I am able to get these books out, and I have a whole bunch that are coming up, I'm able to hopefully help with this stressful knowledge-based, give them some knowledge-based answers to some of those questions.
Yes. Oh, excuse me. So you mentioned the sandwich generation and you started to explain exactly what that is. So for us that may be coming up on that and may not really understand it, can you just expand a little bit more on what a sandwich generation is and how you know if you're actually in that generation?
Sure, of course. So it often happens, many of us wind up in the sandwich generation because we're having children, many of us, not everyone, but we're having children older and our parents are living to be older. So we might wind up at some point being in a situation where our parents need a lot of our care. They need help with their medical appointments. They need help with their medications. They need help with sometimes with basic like activities of just like living. And so you're spending a lot of the time focusing on them if that's what you choose to do. And a lot of us, I think, would feel guilty not to do that. And then you're also caring for your children. And we have conditions that are on the rise. Autism, food allergies, just all these conditions are on the rise. So you might wind up with a child who needs therapies or who has other kinds of special needs. Or you just like, even if that isn't the case, because that's a stressful version of the sandwich generation, you could just have one child, like taking care of your child, and taking care of a child, and sometimes can be stressful enough. Plus, you're taking care of your parent. It doesn't have to be that extreme.
Yes. So I'm blessed at this point in time that my parents are still healthy, but I do have a 2-year-old, so I can definitely see how that would be stressful if I did have to take care of my parents at this point in time and my 2-year-old. But I definitely have a lot of patients and clients that are in this generation, and they would say they're having a hard time trying to care for themselves. So why would you say it's hard to stay healthy when you're in this situation trying to take care of family, your parents, and your child?
Very, very good questions. I think part of it is a lot of us don't either have the resources or the time to necessarily be able to delegate everything out, or we want to keep doing a lot of it ourselves. And there's only so many hours in the day. And your child needs you, your parent needs you. And so what a lot of us do is we self-sacrifice.
Mm.
We take the time that we should be spending on ourselves and use it to take care of everybody else.
Mm-hmm.
And when that happens, there's certain basic needs of ours that we're still able to hopefully to meet. Like hopefully we're still taking showers. Hopefully we're still eating. Right?
Yes, yes.
Eating. So hopefully we get some sleep. Hopefully, but other things that are really important for us, for our mental health, for our physical health, like exercise, like eating healthy, like taking time to have social relationships and taking time to have friends and maintain
Mm-hmm.
friendships, can take a back burner.
Mm-hmm.
So you wind up isolated but not isolated, in that
Mm-hmm.
you're surrounded by people, you're helping others, but these relationships that are more with your equals and more with your peers, they tend to decrease.
Yes.
And we are social creatures, so when that we don't, most of us are, when we don't have that social ability, and we can't express it as much, we can get anxious, we
Mm-hmm.
can depressed. And then when we're spending so much time taking care of others, we don't necessarily always take care of ourselves in other ways that increase the body's levels of stress.
Mm-hmm.
So let's say that we're really under a lot of stress. We might have increased cortisol levels in our bodies. And increased cortisol levels are associated with more inflammation throughout our bodies,
Yes.
increased elevated glucose levels. So if under a lot of stress, like one of my stories is when I was under a lot of stress, and this summer, because I talk about stuff that's I'm experiencing as well.
Mm-hmm.
This summer, my mom was in the hospital for almost 2 months.
Oh my.
And it was really stressful for me because even though she was in the hospital, I wound up having to do so much of the caregiving.
Mm-hmm.
And doesn't help that I'm a doctor, so it's accepted. And when you're spending so much time caregiving, like my hemoglobin A1C went from, which is a marker of your glucose levels, went from 5.2
Mm-hmm.
back in February to 6.4
Oh wow.
with the level of stress, because it increased my cortisol levels and nothing else changed. My glucose went high from the stress.
Mm.
As I just had my hemoglobin A1C repeated again, nothing has changed. Well, except I also had surgery for a tumor, but nothing else has changed. And my hemoglobin A1C now is back down to normal.
Oh my. That
So
is okay.
effect in how your body reacts to that stress.
Yes, yes. So we know that that is very stressful, like you said, like trying to be the caregiver for ailing parent and child, and you put yourself on the back burner, and then all of a sudden yourself are starting to become unhealthy. So we definitely don't want that, and we usually tell people that if you don't care for yourself, you're not going to be able to care for others, right? So, what are some of the tips that you would give caregivers in this sandwich generation on how to stay healthy?
It's a tricky situation.
Mhm.
Being a caregiver can be a job that requires a lot of your hours, and that can be thankless because children don't always thank you for everything.
Mhm, mhm.
And neither do the parents or other people you might be caring for, especially if they have chronic diseases that change their personalities. And
Mhm.
so it winds up being a thankless job where you're doing so much for other people without taking care of you. And yet, if you do not take care of yourself, you are increased risk of developing a medical condition. So
Mhm.
I like to think of it in terms of this. This is like a little
Oh.
thing I wanted to show. So this is a cup. There's 2 cups. All of us have genetic predispositions to various kinds of diseases.
Mhm.
And those genetic predispositions vary from person to person. They're the blue area of each of these cups.
Mhm.
One person has more of a genetic predisposition to some of these medical conditions that are stress mediated. That if you're under more stress, you're going to have, you're more likely to develop them when you wouldn't otherwise. And others of us, not so much. So now we add the stress level to it. And it could be a similar stress level in each person, right? Similar. The stress is the red part. It could be similar in each person. But if you already have that increased risk, then your cup is going to overflow. And what I mean by that is that this person will still seem fine, right? They still have similar stress, but their predisposition to developing something as a result of it has not pushed them over the edge.
Yeah.
Versus the other person who has had too much stress and now it's pushed them over the edge and they're going to wind up with something at some time.
That's interesting, because a lot of people may think that they are weaker, or they don't know how to deal with stress because they may be that person that has that higher predisposition, and they're like, well, everybody else has this going on and they're not having these problems, so why do I have that? And so that's a good illustration of what may be going on. So I thank you for that, because that's I never even thought about it that way, but that is definitely something that we need to keep into consideration when we're dealing with stress. And that's why we want to try to not build that stress up and actually get some help from there. So how would one avoid their cup running over, as you would say there, in a negative way, and try to keep that those pitfalls from coming about for them?
Right. And so then we're talking about two different aspects of how we can do it. We can do it by trying to lower the level of stress. Some of that is trying to meet some of your higher needs. For instance, finding time for those friendships, even if those friendships are online friendships, because that's all you have time to do. But finding time for friendships. Maybe that means seeing a life coach or a therapist. Now, therapists usually look at your past to kind of help you to determine what's going on. They look at your psychological disorders and help you with that. Well, as opposed to a life coach who more asks you what's going on right now and tries to coach you with what to do later in life. I actually became a life coach. And yeah. And so having that social aspect to it, again, reminding yourself that you are social creatures at some point, you need to have your needs met as well. May helps with some of the stress. And getting knowledge about the medical conditions from writing some of my books can help with the stress, because once you have more knowledge, you're better able, more efficiently, hopefully, able to care for the condition. So again, we're decreasing the level of stress. The other way that you can kind of prevent that cup from overflowing is you look at it from the genetic and the predisposition standpoint, because there's a interplay between genetics and your environment. And sometimes you may be predisposed just because the way that's your genes, you may be predisposed to certain things, but there's certain things you can do in life to decrease your chances of developing something. So if all we do is we eat junk food all the time, and because we eat junk food all the time, we develop all of these vitamin and mineral deficiencies, and we don't get enough protein, some of the basic amino acids that we need, we don't get enough of them. Then we're going to be at an increased risk of getting certain conditions. Right. If we come into it already obese, we have other smoking, doing lifestyle things that don't help us, that blue part is going to be higher. We're already at an increased risk of developing something. And I think that's kind of where your work comes in, because you're helping so much with getting this blue part to improve with people. So even if they have the same amount of stress, they might not necessarily get those diseases. Right. A whole bunch of diseases are stress linked. Yes. Yeah. So yeah, I do focus on that a lot, that just because you have the genes does not mean you have to activate those genes. And you talked about several things that can be done to decrease that so your cup does not overflow. So again, I love that illustration that you're showing, because that actually
when people talk, you're like, okay, maybe I get it, but a picture, like I said, is 1,000 words. So thank you so much for showing that. So you mentioned too that you had this, you're actually in the generation now, and you've mentioned that your health has actually suffered some. And so what would you have done differently if you knew that you was going to go down this path to try to prevent those things from happening for yourself?
Sure. So I would have gotten medical care for myself faster. I think I would have gone for my physical faster. I would have, when I was not feeling good, I would have pursued it more,
Mm-hmm.
as opposed to in my head adopting this belief that do not doctor yourself.
Mm.
Somebody else doctor you. And so if the other person does a rudimentary exam, doesn't necessarily listen,
Mm-hmm.
that means that it's fine, when in fact it isn't.
Mm-hmm.
For me, the other thing, and I'm writing a book about this too, because I want to educate people. I wound up really, really high level of calcium in my body, and it affected everything.
Mm-hmm. Mm-hmm.
It just affected all kinds of body systems. Now that's resolved, I'm cured, but
Good.
yay, I know. But while I was experiencing it, it was hard to care for everybody else.
Right.
That, and especially before I didn't have answers. I just
Mm-hmm.
thought, like, sometimes other people think too, when you're under so much stress, that you are just going to get just stress related. It's all stress. You can go get rid of the stress, everything will be better.
Mm-hmm.
When in fact, what was happening to me, and I have a feeling that this happens to other people too, is you are under so much stress that your cup overflows and you actually wind up with something. It isn't just stress. There's an actual medical diagnosis.
Mm-hmm. Yes, yes. So what I hear you saying is definitely listen to your body. So if you feel like something's not right, don't just say, oh, it'll get better on its own. Definitely go get checked out and see what your medical provider has to say, and see if there's something that can be done. Or like you were saying, if you do that and then they're like, yeah, everything looks good, and maybe your stress level, then you may reach out to like a life coach that can actually help you navigate through what's going on at this point in time for you. So thank you so much for all that information. So you've mentioned several times that you are writing books. So tell us about a book that you already have or that's coming up, so we can actually look into that.
Oh my God. I have written 5 books.
Oh, wow. Okay.
So they're all written. One is about babies with colic who just cry and cry, because I think that's what's out there is not complete enough. We have so much more information about colic. And colic can be incredibly stressful to parents. Children cry and cry. So I researched over, of course I have all my patient experience. I've been a doctor forever, but I've researched over 1,000 research articles on colic.
Oh, wow. Okay.
I summarized them all in the book. And I think that's going to be really helpful. I have a book, I have a redo of my book about FPIES, which is food protein induced enterocolitis syndrome. It's a type of non-IgE mediated food allergy, and that's out there. I think it was a bestseller for a bit.
Oh, wow. Okay.
So that one's out there, and that's for people who are stressed because they have a baby who's throwing up a lot and has unusual stools, and they're trying to figure out what's causing it, and maybe they have some feeding issues, and you just want to look at it. So a book about that. I have a book about feeding challenges in children. I have a book about calcium levels and calcium disorders in children. And I even have like a podcasting book I just came up with, and it's a little bit off topic, but it's because I'm a physician. I can look at information, I can try to digest it and explain it to people in ways that are easy to understand, so that hopefully I can decrease their stress level because they'll have more knowledge. But I'm still trying to figure out all the marketing, and I'm still trying to figure out how to get it out there.
Yes.
I'm really just trying to help you.
Yes, yes. So what we'll definitely do is put links in the comments or in the description for the video today.
Written, but I'm trying to figure out marketing out for one, and then just send them one by one. I'm expecting to do one a month.
Okay. Well, excellent. So we'll come back as you're getting those updated, and because this will live on my YouTube channel. So when people ever watch it, they can come back and see what's going on, because you gave us so much valuable information that I'm sure a lot of us that's in the sandwich generation that have those younger children, that if we can get some more information of how to care for them and decrease our stress level, that will definitely be a great resource for us. So thank you so much for coming on. Is there any final words that you want to leave to the audience, or like social media handles or anything like that that you would want to let them know about?
Oh gosh. So drevka.com.
Dr. Evka,
Or
Evka.com.
my author name, Eva Cesnek, but everyone's like, what's Cesnek? MD.
Okay, all right. And I will definitely, like I said, put that in the description so people can have that information. It was lovely talking with you. Thank you so much for all your information, and we'll be chatting soon. All right.
Oh gosh.
Bye-bye, everybody.